Okay, this is the MDC Exam 2 review. So this is Chapter 24, Assessment of the Respiratory System. Define the different adventitious lung sounds. What conditions are associated with these abnormal lung sounds? So it's wheezing, rhonchi, crackles, stridor, friction rub. So wheezing is squeaky musical sounds. It's asthma, inflammation, bronchospasm, edema, secretions, pulmonary vessel engorgement. Rhonchi is lower, pitched, coarse, continuous snoring sounds, obstruction by foreign body or tumors, thick secretions, sputum production. Crackles is rattling sounds, bronchitis, pneumonia, tumors, pulmonary edema. Stridor is upper airway obstruction. Friction rub is loud, rough, grating or scratching, pleurisy, tuberculosis, pulmonary infarction, pneumonia, and lung cancer. Chapter 26, Concepts of Care for Patients with Non-Infectious Upper Respiratory Problems. List the reasons that can cause epistaxis: loss of tissue integrity, trauma to nasal mucosa, hypertension, bloody dyscrasia, inflammation, decreased humidity, nose blowing and nose picking, chronic cocaine use, NG suctioning. Review emergency care for a patient with an anterior nosebleed. Posterior packing, epistaxis catheters, which are nasal pressure tubes, gel tampons. Be cautious that this can obstruct the airway if the packing slips, and cauterization, litigating the blood vessels, perform embolization. Why is bleeding from the posterior nasal cavity an emergency? Because it cannot easily be reached and the patient can lose a lot of blood really fast. Discuss patient teaching on prevention. Apply a petroleum jelly sparingly to nares for comfort. Use saline sprays after healing to add moisture and prevent rebleeding. Avoid vigorous nose blowing, use of aspirin or other NSAIDs, and strenuous activity such as heavy lifting for at least 1 month. If a client suffered a fracture to the nose, what is your primary concerns if you begin to see drainage from the nares? What is your next action? Primary concern is cerebral spinal fluid. It's a clear fluid, and if you put it on a cotton ball, you will know it's cerebral spinal fluid because it will have a yellow halo. Positive dipstick test for glucose can detect if it is CSF because it will smell kind of fruity or sweet. And the yellow halo on a piece of filter paper. Why is a rhinoplasty performed? What is your priority assessment post-op? It's a surgical reconstruction to either repair a fracture or change the shape of the nose. Obstruction for edema after surgery and bleeding to evaluate for loss of tissue integrity. What kind of dressing is used? It's a mustache dressing and packing. Describe the different categories of pneumonia: community acquired, healthcare associated, hospital acquired, and ventilator associated. Define obstructive sleep apnea. It's a type of breathing pattern disruption during sleep that lasts at least 10 seconds and occurs a minimum of 5 times in an hour. How do CPAP devices work? Non-invasive positive pressure ventilation. Positive airway pressure delivers a set of positive airway pressure continuously during each cycle of inhalation and exhalation. What are the clinical manifestations of laryngeal cancer? Painless hoarseness. Head and neck cancers usually develop from what type of carcinoma? Squamous cell carcinoma. What are the treatment options? What are the criteria for choosing one treatment option over the other? Surgery, radiation, chemo, or biotherapy can be used alone or combined. Radiation therapy is used for small cancers in specific locations. Chemo is often used with radiation therapy. Biotherapy is used for people whose tumors overexpress the receptor it blocks, the epidermal growth factor. And surgery is determined by the tumor size, node number, and metastasis. Discuss patient teaching regarding these treatment modalities. Tracheostomy is needed after a laryngectomy. Partial laryngectomy, it will be temporary, and they could need feeding tubes, ventilators. They will need to learn new methods of speech, shoulder drop after extensive surgery. What are your priority assessments when it comes to post-op care? Airway patency, vital signs, hemodynamic status, and comfort. Chapter 27, Concepts of Care. What are two disorders that fall under this umbrella term? Emphysema and chronic bronchitis. What are the differences of manifestations between them? Emphysema is hyperinflation, no recoil in alveoli, that's blown up, and chronic bronchitis is thick mucus production that's gunked up. Discuss the risk factors of COPD. If you were providing teaching in the community about how to prevent COPD, what are some important points you would include in your teaching? Prepare education on smoking cessation. What are some clinical manifestations of COPD that you might find during your assessment? Breathing patterns, skin, chest, neurostatus. You're going to find hypoxemia, acidosis, respiratory infection, cardiac failure, dysrhythmias, respiratory failure, and barrel chest. What would labs show? Respiratory acidosis. What position would you typically see the patient in? Orthopnic or tripod? Diagnosis of COPD is based mostly on chronic bronchitis. Patient with COPD may need an oxygen flow of their baseline via nasal cannula or up to 40% via Venturi mask. All hypoxic patients, even those with COPD and hypercapnia, should receive oxygen therapy at 2 liters. COPD patient education on breathing is pursed-lipped breathing. Okay, what are some clinical manifestations of cystic fibrosis? Thick, sticky mucus anywhere there is a mucosa. What are the signs and symptoms associated with cystic fibrosis that are unrelated to pulmonary? This is abdominal distension, GERD, malnourishment, diabetes, and osteoporosis. They have an issue absorbing fat-soluble vitamins, A, D, E, and K. What type of genetic disease does it fall under? Autosomal. What type of supplementation will most of these patients require with each meal? Fat-soluble vitamins, vitamins A, D, E, and K. List patient education points for asthma management. Asthma triggers are aspirin and NSAIDs. What is the difference between control to reliever drugs? Provide some examples. Montelukast you take at night. Leukotriene is a receptor antagonist. Albuterol is a rescue inhaler and a bronchodilator. When are they used? How would you instruct a patient who is using 2 types of inhaled medications? Wait 5 minutes before taking albuterol after a corticosteroid. Why is status asthmaticus an emergency? It's life-threatening. You stop breathing, cyanotic. What should you do? Rapid response. As pulmonary hypertension progresses, what does it lead to? Increased pressure of the lung that lead to heart on right, left-sided heart failure. Cor pulmonae if heart-lung transplantation is needed. What are the warning signs associated with lung cancer? Repeated exposure to inhaled substances that cause chronic inflammation or irritation. When do symptoms appear? Advanced stage. What are the signs and symptoms that appear later? Hoarseness and cough. What is the treatment of choice? Chemo, targeted therapy, and lobe removal. When is targeted therapy used? Genetics. How about surgical management? We can live with 1 lung, a lobectomy. Review considerations regarding chest tube placement and care. Pleural effusion due to fluid in the lung. Continuous bubbles equals a leak and call provider. This means it's a collapsed lung. What are some comfort measures that can be applied to a client with lung cancer who is complaining of dyspnea? If the chest tube comes out, it should be covered with a wet or occlusive dressing. No air coming in. Who is at risk for developing pulmonary fibrosis? How quickly does the disease progress? After lung inflammation continues beyond healing time, causing fibrosis and scarring. What is a person's likelihood of survival? 3 to 5 years. What viral strains can cause influenza? This is chapter 28. This viral strains are A, B, and C. What cues can a patient present with? Rapid onset of headache, muscle aches, fever, chills, fatigue, and weakness. Sore throat, watery discharge, and cough can also occur. When are patients considered to be contagious? 24 hours before symptoms start and 5 days after. Which population would you recommend a flu vaccine to? For adults, intramuscular. Senior flu shot for those over 65. For adults under 50, a nasal spray has been approved to use. Those with chronic illness reside in institutions or live with or care for those with health problems that put them at risk for complications from influenza, healthcare personnel providing care to patients. What treatments are available and when are they most effective? Oseltamivir, zanamivir, and permavir. These effective in prevention and treatment. They can be given to adults who are at high risk that have been exposed to influenza without being vaccinated. Describe the different categories of pneumonia. Community acquired outside of the hospital. Risk factors are being an older adult, has never received the pneumonia vaccine, did not get the flu vaccine in the previous year, chronic problems that reduce immunity, recently been exposed to viral infections, uses tobacco or alcohol, and is exposed to high amounts of secondhand smoke. Healthcare associated is an onset of pneumonia occurs less than 48 hours after admission in patient with specific risk factors. In hospital for greater than 48 hours in the past 90 days, living in a nursing home facility, received IV therapy, wound care, chemo within the last 30 days, seen in hospital or dialysis clinic with the last 30 days. May have multi-drug resistant organisms. Hospital acquired is onset on pneumonia greater than 48 hours after admission to the hospital. Encourage pulmonary hygiene and progressive ambulation. Provide adequate hydration, assess risk for aspiration, monitor for early signs of sepsis, hand hygiene, provide rigorous oral care. Ventilator associated is onset of pneumonia within 48 to 72 hours after endotracheal intubation. Presence of T-tube increases risk for pneumonia by bypassing protective airway mechanisms and allowing aspiration secretions from the oropharynx and stomach. Dental plaque also increases the risk. Initiate ventilator orders. This is elevate head of bed at least 30 degrees, daily sedation, vacation, and weaning assessment, DVT prophylaxis, oral care regimen, stress ulcer prophylaxis, suctioning, either as needed or continuous subglottal suction, hand hygiene. What signs and symptoms might lead you to suspect pneumonia in a patient? Crackles in the lungs, diminished breath sounds, wheezing if inflamed can also be hypotensive. A rapid, weak pulse may be indicative of hypoxemia, dehydration, or impending sepsis and shock. What labs and imaging do you expect to be ordered? Sputum examined by gram stain, cultures, and sensitivity testing. CBC to see if the white blood cells is elevated. Blood cultures, ABG to determine gas exchange. Serum electrolyte and BUN. What nursing interventions should be performed? Oxygen and SINF spirometer. Which 2 vaccines are available? Influenza and pneumococcal. What are the CDC guidelines regarding these vaccines? Get them over 65 years of age annually, first with PCV13 followed by PPSV23 about 12 months later. If you already have PPSV23, they should have the PCV13 about a year or more later. Discuss pulmonary tuberculosis. TB is a highly communicable disease caused by infection with Mycobacterium tuberculosis. It is transmitted via aerosocialization. What clinical manifestations would present? Persistent cough, unintended weight loss, anorexia, night sweats, hemoptysis, shortness of breath, fever, and chills. What population is most at risk? Those who have traveled to foreign countries, homeless, living in crowded conditions, or substance use with malnutrition. How is it transmitted? Airborne. What signs and symptoms might lead you to suspect TB in a patient? Progressive fatigue, lethargy, nausea, anorexia, weight loss, irregular menses, and low-grade fever. Dullness with percussion over the involved lung fields, bronchial breath sounds, crackles, increased transmission of spoken or whispered sounds, partial obstruction of bronchus from the disease or compression by lymph nodes may produce localized wheezing. What induration is considered a positive Mantoux result? Area of induration. This is localized swelling with hardness of the soft tissue, measuring 10 millimeters or greater, not just redness. In adults with reduced immunity, induration of 5 millimeters is a positive result. If possible, reevaluate after 72 hours. False positives occur more often at 48-hour read. What does a positive Mantoux result indicate? Indicates exposure to TB or the presence of dormant disease, not active disease. Failure just because the Mantoux test is negative does not mean TB is not present. Failure to have skin response due to reduced immunity when infection is present is called anergy. Which testing confirms diagnosis? Quantiferon Gold test shows patient's immune response to the TB bacterium. If positive, it shows that they have been infected, but not that it is active or latent. Sputum culture confirms diagnosis. Enhanced sputum cultures take up to 4 weeks for valid results. First, list first-line medications. Isoniazid, rifampin, pyrazidamide, ethambutol for the first 8 weeks. Continuation phase is another 18 weeks, takes isoniazid and rifampin either twice weekly or once daily. What are some patient teaching points regarding the meds? Strict adherence to the prescribed drug regimen is crucial for suppressing the disease. Stress regularity and taking the drug for the entire dosage time. When it is prescribed, how long and how often. Give multiple formats of information and multiple formats such as pamphlets, videos, and drug schedule worksheets. What is a key factor that needs to be mentioned when providing education on self-management to a patient and preventing infection transmission? Identify those who have been in close contact with the infected person so they can be tested and treated if needed. You're going to do a sweat chloride test for cystic fibrosis. A client's chest tube will show a leak when there is an increase of bubbling in the water chamber. Pneumonia can be bacterial, fungal, or viral. The most common bacteria are strep and staph for pneumonia. Age 65 and over and immunocompromised should get PCV13 and PPSV23, both 1 year apart. The filter to our airway is our nose. The first indicator of decreased level of oxygenation is confusion and agitation. Pneumonia electrolytes show hypernatremia. ABGs show acidosis. X-ray shows infiltrates to indicate pneumonia. One of the complications of pneumonia is pleurisy. The indications are pain and distension. For TB, active is contagious, and latent is not. If TB patient had a BCG vaccine, note skin test because it will show a false positive. Do a chest X-ray or blood test. TB is bacterial. Ripe is the medication. Rifampin, expect an orange or red urine. That's normal. Isoniazid, it's hepatotoxic and avoid alcohol. Pyrazinamide and ethambutol, that's eyes, visual changes. Sputum culture will confirm diagnosis for TB. The Manteau test is a secondary preventative measure. It's an intradermal injection. 10 millimeter or greater is considered a positive. If you have HIV, anything greater than a 5 is a positive. Peritonsillar abscess is rare. This is airway obstruction, swollen tonsillar lymph nodes, cervical lymph, supraclavicular lymph. Those are all the lymph nodes. Inhalation anthrax is the infection from soil. It's exposure to animals, so farmers and veterinarians. There's 2 stages. Prodromal stage, this is where you experience flu-like symptoms, but no runny nose and will have mediastinal widening. And the filament stage, this is a sudden onset of severe illness. You're going to need antibiotic therapy stat.